All right, so thanks everyone for joining us again. My name's Jessie. I'm with Pennsylvania Health Access Network, and we are co-hosting this webinar with David Johnson from CARIE, the Center for Advocacy for the Rights and Interests of the Elderly. Today's presentation is about the Community Health Choices Participant Advisory Committees, better known as PAC meetings, and we'll be talking a little bit about how folks can get more engaged in these meetings and other tips for self-advocacy.
Good afternoon, everyone. Echoing Jesse's sentiment, we thank you all for participating in this webinar and expressing an interest in learning more about participant advisory committees and engaging more consumers that have been enrolled into Community Health Choices, or CHC. If you have any difficulties hearing me or my audio is off, please let me know in the question box and I'll see if I can adjust it. In today's webinar, we want to provide an overview of PACs. Jesse and I, we are both one of many advocates working with consumers that have been enrolled into Community Health Choices, providing education about what has changed with Medicare for those duly eligible for Medicare and Medicaid, what has not changed with Medicare, how to navigate these new insurance companies, what benefits are available to them, and of course, troubleshooting issues as they arise. We're certainly passionate about consumer feedback and hoping to ensure that the consumer experience and quality of life of people enrolled in Community Health Choices is as optimal as can be. Today, we're going to be focusing specifically on these participant advisory committees as an avenue for consumer advocacy and making improvements within CHC MCOs and throughout the entire CHC system. So we will be providing a general overview and general information about PACs, including what they are and what each CHC MCO is required to do. Because not all because not all CHC participants can participate in a PAC, or they may not be interested in participating in a PAC, we're also going to discuss some high-level general advocacy tips that could benefit all consumers. We'll also hear from representatives from each of the MCOs. They will be discussing their respective PACs, how they operate, and we'll provide some other key information as well. And we'll be able to participate in a question and answer session at the end of our webinar as well. We'll also close this webinar by identifying resources that can help consumers that need assistance under Community Health Choices. There are a number of different opportunities for consumers and other stakeholders to share feedback on CHC, and we'll share some more of these opportunities toward the end of our webinar. Given how CHC is a relatively new program that dramatically shifted the way in which critical services and supports are provided and paid for, we think feedback is essential to help ensure that CHC works as well as it can for all participants. As we mentioned today, we're focusing specifically on one opportunity for consumer feedback and stakeholder feedback, the Participant Advisory Committee, or PAC. PACs are opportunities for participants and other stakeholders to share feedback directly to plan leadership. PACs are comprised of committee members that are enrolled in CHC plans, including individuals getting long-term services and supports, family caregivers, direct care workers, and other providers as well. Each CHC MCO has PACs across Pennsylvania. So regardless of where an individual lives, in whichever CHZ zone they're in, there will be a PAC that is local to them. We're front-ending this presentation on emphasizing that consumer feedback and input is critical and essential. Whether in a PAC or not, again, we must emphasize that consumers in CHC have rights, and their needs, experiences, and feedback are crucially important. Participant and stakeholder feedback can help make sure that CHC is meeting the needs of consumers and that CHC managed care organizations are responding to the needs and input of consumers and stakeholders alike. CHC marks a dramatic systems change for consumers duly eligible for Medicare and Medicaid and adults receiving Medicaid-funded long-term services and supports, whether at home in the community or in a nursing facility. The introduction of a new managed care insurance company for these consumers, particularly for those getting these critically needed services at home in the community or a nursing home, is a dramatic shift from the previous fee-for-service Medicaid system. PACs are important because they provide a direct way for participant and stakeholder feedback to be heard by the CHC MCOs and ideally incorporated into plan operations and governance. But regardless of whether a consumer is a PAC member or not, there are other opportunities to have voices and experiences heard. Please feel free to contact either Jessica or me after this presentation for more information on how to get involved. Our contact information can be found at the end of the presentation. There are a number of different opportunities for consumers and other stakeholders to share their feedback on CHC. And given how CHC is a relatively new program that dramatically shift the way these services are provided and paid for, again, feedback is essential to make sure that CHC works as well as it can for all participants. While focusing on PACs, PACs are opportunities for participants and other stakeholders to share feedback directly to plan leadership. PACs are comprised of committee members that are enrolled in CHC plans. These individuals getting these long-term services and supports, and those who are direct care workers and other providers. What happens at PAC meetings will vary depending on the plan, but we're going to focus specifically on what generally consumers can expect should they be participating in a PAC meeting. Later during this webinar, we are going to be hearing from each CHC MCO about how their PAC meetings are run, how they solicit feedback, and how feedback is shared with their plans. Generally speaking, though, PAC meetings will all have a similar structure. CHC plans report on the following: any updates or proposed plan changes, the number and nature of complaints made to the CHC plan, any quality improvement proposals, and the minutes of previous PAC meetings. These meeting minutes are available and are shared with the public and can be found on the CHC MCO's respective websites. Depending on participant feedback, plans may present on specific topics like transportation or home modifications or other benefits, services, or plan operations. Just as significantly, PACs should also offer an opportunity for participants to share their feedback on areas and issues concerning participant quality of life and their experiences with the CHC MCO. PAC members can ask questions or raise issues and concerns, and it also can be an opportunity to share feedback on what is working well within a CHC MCO. As part of the CHC agreement between each of the MCOs and the Office of Long-Term Living, each PAC must meet certain requirements. There are 5 CHC zones across Pennsylvania. For each zone, each CHC MCO must have a PAC operating within that zone. PAC group composition must include participants, their caregivers, provider representatives, and direct care workers. The driving voice behind PACs are the participants themselves, and they must make up a majority of group composition. In addition, 25% of the total PAC membership must reflect consumers getting long-term services and supports, or LTSS. PACs are expected to be demographically and geographically diverse. Consumers, regardless of age, race, ethnicity, gender, sexual orientation, language proficiency, and geographic location, should expect to feel represented in these PACs. And lastly, PAC meetings must meet at least 4 times per year. Meetings are to be held in person, and MCOs are expected to assist consumers interested in participating in person, providing reasonable accommodations for in-person attendance.
And PACs should also be culturally competent. As a lot of the communities that they serve are becoming increasingly diverse, each MCO should strive to be as competent to account for the different needs of the individual communities. The number one example of this is via foreign language interpretation services, which are provided at the PAC meetings, I know for various different languages and can be requested. Other ways which can be continuously improved to account for the cultural differences can include taking into account areas such as power dynamics, incentives such as food, which could be more local to the various cultures, increased transportation services, and clear two-way communication between the PAC representatives and the plan participants. Other ways to also generate increased participation based from feedback from our immigrant work group include general explanations of what the PACs are and explanations of how the time folks can expect the timeliness for things to actually change and take effect, as these are gradual changes which can take a little bit longer and are not often immediately seen. And there's also ways that they can have trusted advocates who that they can speak with and help promote a better understanding about the plans.
Before we hear from each of the MCOs, we want to provide some general high-level tips for preparing for a PAC meeting, or otherwise just general self-advocacy tips. Space in PACs is limited, and consumers must apply to their CHC MCO if they're interested in serving in a PAC, or at least demonstrate an interest in participating in a PAC. Whether someone is in a PAC or not, consumers can consider the following tips and questions for self-advocacy to help communicate needs and experiences, whether they're good or bad. Later in this webinar, we will outline some of these other opportunities outside of a PAC for stakeholder engagement, whether directly with the state, with plans directly, or through advocacy groups like PHAN or CARIE. Tip number one is to be clear with what a consumer would like to say. A consumer could think about, with regard to good feedback or positive feedback, identifying what worked well with regard to their experience with a CHC MCO. Is there someone or something that should be recognized and amplified for their quality service delivery or just otherwise good experience with the plan? If someone has critical or negative feedback, identifying what went wrong. If there's more than one problem, an individual could try to break it down into component parts or smaller pieces. Focus on what is important to a consumer and have that pressing issue addressed first. Taking time to organize one's thoughts about feedback that is to be shared can help ensure that the appropriate decision makers understand the feedback and issues clearly and can help solve problems more quickly. But regardless of how feedback is communicated, it is important that consumers have the opportunity to be heard. The second tip would be to set a goal. Depending on the issue or concern that a consumer is sharing, it may be a simple fix or it may be more involved, complicated process. The consumer should ask, what would I like to have addressed first? Am I able to prioritize problems from most important to least important and have them addressed in order? What would be a good outcome is another good question. Some problems may be unable to be resolved and some may take a while to be addressed. By setting goals, it will help keep focus on important issues that matter to consumers and, just as importantly, other participants as well. Tip number 3 would be to gather documents. Gathering plan information and other documents to support one's message can be helpful in amplifying this feedback. Bringing any notes about one's experiences or interactions may be helpful as well. If a consumer feels that their experience is documented in their member handbook or other CHC materials, it also can be helpful to reference those documents. Lastly, tip number 4 is knowing one's rights. Here are just a few. A consumer has the right to file a complaint at any time and for any reason. A consumer has the right to appeal any loss or denial of services. And if a consumer is not happy with their CHC plan, they have the right to change plans at any time for any reason. And of course, we shouldn't place the onus of knowing one's rights entirely with the consumer. Should someone have questions or concerns, they can certainly reach out to groups like PHAN and CARIE for some assistance.
All right, thank you, David, for that general overview about the PAC meetings. With that, we will go ahead and kick it off with our each of our MCO representatives. And our first guest speaker is Ms. Maritza Padua, who is speaking from Keystone first. All right. Can folks hear Maritza?
Okay. Can everyone hear me now?
We can, yes.
Perfect. Good afternoon, everyone. My name is Maritza Padua. I am the Community Outreach Program Manager for Keystone First Community Health Choices, and I will be presenting on the Participant Advisory Committee topic this afternoon. So, to discuss goals and values for the Participant Advisory Committee meeting, the goal is really to provide a forum for participants, providers, caregivers, family members, and direct care workers to raise questions and concerns and advise about the need and experiences of all CHC participants, in addition to discussing opportunities for improvement. As far as values are concerned, PAC gives the health plan the opportunity to discuss benefits and services directly with participants and PAC committee members. It provides us, at the health plan level, a frontline view of participants' needs and experiences. It provides an opportunity for various departments within our organization to present to the PAC members and receive feedback on their experiences and additional ways to improve our communication to and with participants and providers. This feedback helps inform our approach to quality measures, initiatives, and potentially streamline or improve a process. There's no wrong way or there's no wrong door for a participant to use to express their interest in joining our PAC. We ask that participants, CHC participants, call the numbers on their screens or reach out to me personally. My information is on your screen as well, or contact your case manager or service coordinator. We reach out to participants or provider representatives that express an interest in joining our PAC. We review the goal and objective of the committee with those individuals. There is not a formal application process on our end or an approval process. Just their desire to be involved is enough. Once we reach our committee member cap, which is 30 as approved in 2018 by OLTL, we will notify the individuals and keep their names on file in the event a vacancy occurs. We have a separate PAC in each zone under CHC, as mentioned earlier by David. Removing barriers to participation, transportation and interpretation services are available to each participant advisory committee member. All travel, mileage, or bus expenses are reimbursed. All locations are based in the community with reasonable access, and meals are provided at each PAC meeting. In an effort to incorporate participant feedback as an improvement to PAC, we are exploring the feasibility of adding or perhaps of adding a feedback piece or perhaps a separate PAC updated mailing. This could be a way to share with all our participants the information discussed during our meetings versus them having to go to the website to read the meetings on their own. PAC minutes and action items are reported quarterly at the Plan's Quality Committee and dispersed from the committee members to other departments. This feedback helps inform our approach to quality measure initiatives and potentially streamline or improve process. The PAC chair and co-chair provide an overview to the CHC administrator. The CHC administrator presents PAC minutes and action items to our executive leadership. And finally, if an urgent situation or issue is raised at one of our PAC meetings, we act upon it immediately and include any department impacted by the feedback. If an issue is discussed during a PAC meeting, needs follow-up or may change a process, we will schedule a meeting with the department to discuss the committee feedback and next steps. And that is our overview of the Keystone First Community Health Choices PAC.
All right, thank you so much, Maritza. And just as a quick reminder to folks, if you have any questions as we're going through the webinar, please make sure to send those in on the sidebar, and we will address those at the end of the presentation. Our next speaker is Mr. Malik Haynes from PA Health and Wellness. And we just want to make sure he gets on the audio. Seems we're having a little bit of a technical difficulty. All right, give us just 1 second.
Are you able to hear me now?
Yes. All right, thank you.
Okay. Thanks. Appreciate that. I do apologize for that. We're just some technical difficulties here. My name is Malik Haynes. I am the manager of quality improvement at Pennsylvania Health and Wellness, and I'm responsible for the PHAN's accreditation and CAP survey. And I'll just take a quick moment here to talk to you about Pennsylvania Health and Wellness's Participant Advisory Committee. Pennsylvania Health and Wellness views the Participant Advisory Committee as an avenue to solicit input for quality improvement activities, a mechanism to provide feedback directly to our staff. We view it as a focus group for members, and also as a means to help identify strategies and opportunities for improvements. The goals for our PAC is to solicit participant input into our quality management program based on the experience and needs of the participants, to act as a focus group, again, to facilitate participant perspectives on the quality of care and the services offered by our plan, and lastly, to offer recommendations for improvement based upon the participant experience. The PACs have provided feedback on our CAP survey. You can flip to the next slide. We've reviewed our proposed interventions and provided additional suggestions. The value also is it provides more granular feedback based on personal experiences, and again, serve as a focus group when needed. The value that the PAC brings to the organization is we provide them with information on our customer service and complaints and grievances data at every meeting, which is very interested in the drill down of the categories. As you can imagine, there's always a good amount of discussion when it relates to complaints and grievances. They also review the participant education materials for relevant and ease of use prior to us sending out to the participants. So how can participants become more engaged? There's not a formal application process at this time. The quality department receives recommendations from already assigned PAC members or from case managers, service coordinators, or service coordinator entities, and community partners. Our Vice President of Community Outreach and Marketing, along with her team, regularly communicate the opportunity for participants to join the PAC during their meetings and interactions and events that they attend. So you can become more engaged if you want to visit our participant website. The website has a section with information and the meeting minutes titled Participant Advisory Council. And I believe you guys will get this slide deck afterwards, so you'll be able to visit that link and get some additional information, which again has the minutes and agenda items and how to participate. So the incentives to remove barriers for participation in the PAC is we provide a toll-free number and a WebEx Zoom meeting conference so folks can participate remotely. We provide snacks and drinks for folks who attend in person and also provide a hot lunch for on-site participants and their caregivers. We provide all meeting materials in Braille to folks who may require that, and you will get that at least 2 weeks prior to the meeting, as well as the minutes and the agenda. And we have a dedicated person in our customer service team that arranges transportation for all participants who need or request assistance. The quality team, as far as how we take how we incorporate the feedback, the quality team takes the concerns and issues that were discussed through the PAC back to the organization, to their respective business owners, and we track and follow up on all that information until resolved and presented back at the next PAC meeting. The chairperson reports the activities to our quality management committee, which is comprised of a multifaceted team of the organization as well as external doctors. And lastly, the Chief Medical Officer provides a verbal report to the Board of Directors following the PAC committee, which includes a summary of the meeting, the actions taken, needed follow-up, responsible parties for addressing any issues identified. And I will say that the board is always interested in the participant advisory feedback. I think that is it for my slides. Thank you.
Thank you so much. And our last speaker is from UPMC Community Health Choices, and they will actually be tag teaming it between Ms. Amanda Mihalko and Aliyah Kabir.
Hi, this is Amanda Mihalko. Thanks, Jesse, for the introduction. I am one of our managers of community engagement for UPMC Community Health Choices.
And hello, my name is Aliyah Kabir. I'm one of the managers for Community Health Choices, and I'll be tag teaming it again with my colleague Amanda.
Okay, so we can move to our next slide. Like others have mentioned, our goal is very similar with our UPMC Community Health Choices PACs. We really look at the purpose of our PAC to create a committee of engaged individuals willing to provide constructive feedback to us at UPMC CHC. And our goal is to take that information and tailor policies and services to meet the needs of our participants. Last year, we spent a lot of time here in the Southwest Zone making sure everybody really understood what CHC was, what benefits UPMC CHC could provide to them. And this year, we really wanted our focus to be more directed discussion to really gather that feedback and put it into our policy and program changes. We do have an application and interview process to join our PACs. You can do an application either online, so there's a link there, or you can do a paper application. Aliyah is going to go through our contact information at the end of our slides here, so you could contact any of the people on that contact slide and they'd be able to provide that to you. Also, if you go to the UPMC Community Health Choices website, you can navigate to where this application is. That's also where you can find our meeting minutes as well. After we receive the application and we review it, and just to note, it is not a long or lengthy application at all. It really just asks your name, some basic information, and we want to find out why do you want to be a PAC member and what some of your other experiences may be. We just use it as a baseline to really get in touch with people and set up a phone interview. And that phone interview too, I know it can sound kind of daunting, but again, it's really a brief conversation about why someone wants to be a PAC member. It also gives an opportunity to ask questions, and we do a lot of explaining sort of what we're doing in this presentation. You know, what is the PAC, the agenda, how that works, the roles and responsibilities of PAC members. So we look at that interview. I don't know a better word for it other than interview, but we look at that as really a two-way street. So it's not just us asking questions, but really the participant or the provider can ask us questions as well, and we can have a conversation. We do have, so for PAC membership, we have something that we call our UPMC CHC PAC Charter. And basically it is a formalized document, and it goes through the roles and responsibilities of being a PAC member. It's the same charter whether you're a participant, a provider, or a caregiver. Everybody receives the same application, the same interview questions, and the same charter. And it goes through some of our basics. So, you know, one thing we decided to put into place was a 2-year membership. We had a lot of participants, especially here in the Southwest Zone, who were interested in being at the table, but you know, we want to make sure everybody has a space to have a voice at the PAC meeting. We talk about in that charter the commitment to attend, remaining engaged, and being, you know, staying involved in the PAC, and being respectful of voices at the table. The charter also reviews transportation, like our colleagues from AmeriHealth or Keystone First and PA Health and Wellness said, we have a dedicated transportation team. So we find out who needs transportation and we make sure that we get that organized. That's also the time where we can talk about if there are any accommodations that people need at the meeting. So whether it's something like low vision or translation or anything of that nature, that's addressed in the charter, and we make sure on our end that we make that happen for folks. We want to take care of any barriers that might be in place so that people can be a part of the PAC. And also we have in that charter, what happens if you no longer wish to serve on the PAC? So, you know, how do we handle that, or what are your steps if, you know, you're with us for about a year or so and you realize that maybe that's not the best use of your time, or you have other things happening in your life that may take precedence. So that's also included in our PAC charter. And before we move on to sort of what our PAC looks like, I also just wanted to mention that with UPMC CHC, having the application process and the formalized process for the PAC, we also do things in the community called participant forums, which are basically open town halls for our UPMC CHC participants. And we're planning to do those in all zones. We do them here in the Southwest. Aaliyah is helping to make those happen in Southeast PA, and that's the plan for the rest of the state. So for participants who may not be able to make the commitment to be on the PAC, or this doesn't feel like the right fit at this time, we definitely have other ways and avenues for individuals to get us their feedback. And we take the feedback that we receive from the forums just as seriously as the feedback we receive from our PACs. And with that, I'm going to turn it over to Aaliyah to give you a little more information about our meetings.
Thank you, Amanda. Appreciate it. So what you're looking at right now is just a typical meeting agenda. We usually start with our welcome and introductions. The PAC members introduce themselves to each other. As the year goes on that they are serving, they tend to feel more comfortable with each other. There's a camaraderie that's built there. They become more friends. They look forward to seeing each other. They look forward to seeing us, and we look forward to seeing them. Then there is a PAC overview. We basically go over what the goal of the PAC meetings are, just in case we have a new or a few new people joining, and it's also just good to review. Then we go over, we may go over ground rules, where we discuss how we are going to engage each other in the meeting. We're going to speak one at a time. We are going to hold our questions for the end of each session. We are going to have a break at a certain time or what have you. So we go over the ground rules so that way we can get through the meeting in the most respectable way possible, and it can be most effective in that manner. Then we go on to CHC updates, where we may update our PAC members on exactly what's going on in member services. We may tell them we've answered X amount of calls this month, last month, and we may show them a pie chart or graphics as to what kind of calls we were receiving. We go over complaints and grievances, or we may there may be an update, something in the news where we want to make sure that we address with our PAC members, so we may also overview that as well. Then there is a benefit overview. So what we try to do is divide, we try to select a topic per PAC meeting that educates our PAC members on exactly CHC, what the benefits are. So yesterday when the Southeast team had a PAC meeting, we focused on one of our benefits, which is the health coaching benefit. So we went through that particular benefit, and it was great for our PAC members to realize exactly what they had available to them, for them to ask questions about it, for them to get information on how to start in that particular benefit. And also it helps them take information back to their friends and family who are also UPMC CHC members, participants, and then be able to share that information as well. There's usually lunch that we provide, as the other MCOs do as well. And then there is PAC member discussion. So sometimes there are breakout groups on a specific topic. Sometimes we may just have a brainstorming session where they give us feedback on what we presented and what they would like to see presented. We regroup and give them information on what we are going to take back to our offices and take back to our leadership. And then we go through closing and next steps. Closing and next steps, we usually provide the date and time of the next, date, time, and location of the next PAC meeting. We also let them know if you know any other UPMC CHC members that will be interested, how to get in contact with us. We give them information on the other community events that we may be doing or be appearing at. So if we're going to be at a health fair, if we are going to be in the community in any capacity, we give them a listings of other dates and locations where they can find us. And all of this is also in a folder that we give them that has the slide deck and all of this information, so they can also refer to it later at their leisure. And then we go over any next steps. So here are all the methods in which a CHC participant can contact us. There's email. So both Amanda and I have access to this account here, and we answer those emails directly. We pull them off of the email and we respond to them if needed, or we pass them on to the appropriate contact, the appropriate department. We have our phase 1 by phone, so you can contact phase 1 by phone at the 412 number. Here in Southeast Pennsylvania, there's a 215 number, and then of course we are opening in the middle of the state next year, and we will also have a number for the phase 3. Thank you so much.
All right. Thank you for all that wonderful information. Again, just to share with everyone, we've got the contact information for each of the 3 MCOs on the screen. So, and as I said, we'll be sharing this copy of the slide deck after we wrap everything up. But just real quickly, we do want to make sure everyone's information is available. And as we had also mentioned previously, the PAC meetings are not the only way for folks to become engaged. There are various methods where stakeholders can also participate outside of just the PAC meetings. One example is with the CHC advisory committees, such as the MLTSS submax, which are held monthly and open to the public, either in person or via webinar. There are also the third Thursday webinars, which the Office of Long-Term Living conducts, and is an opportunity to bring up questions and concerns that both participants and other advocates have about the CHC programs. Folks can also sign up for various different mailing lists via email from the Department of Human Services at the link provided here. As we mentioned, also folks can definitely reach out directly to their participant services from each plan for questions about how to become more engaged. And CARIE is also hosting legislative affairs meetings, which you could reach out directly to David for questions. And PHAN also holds immigrant work group meetings, which folks can reach out directly to me if you're interested in getting more involved in those. We also have a handful of other resources which could help. We have the Department of Human Services website, specifically about the Community Health Choices plans, where folks can kind of see a little bit more detail about why the Community Health Choices took effect. There is also the enrollment and information website from Maximus, enrollchc.com, where folks can actually compare the plans side by side and get more information about how to contact their plans or look up doctors and other providers in their network. There is the Office of Long-Term Living Participant Hotline, as well as the Apprise Hotline for other advocates. And also for local to Philadelphia, we have Community Legal Services. And statewide, we have Pennsylvania Health Law Project, which all offer excellent advocacy resources for folks who have questions or would like to otherwise become more engaged. With that, I think we are going to wrap it up with the general presentation and transition into some questions. We've got our contact information on the bottom, so folks can always reach out to us. But if folks would like to go ahead then and send in some questions, and we will share those with folks. There was one question regarding, it was directed to Pennsylvania Health and Wellness, but it's really something I think is applicable for all plans. If we are able to get the dates for the next PAC meetings.
Yeah, we have ours quarterly. I'll see if it's already scheduled. Give me one moment.
So for the Southeast Pennsylvania for UPMC, our next and last PAC meeting for the year will be held December 10th. We'll have more information this week.
Hi, this is Amanda Mahalko from UPMC as well. I just wanted to share our PAC meetings are closed meetings, so they are for members only. So people who've gone through that application and interview process. We do try to post the minutes of our meeting in a very timely manner onto our website, and our minutes for our meetings are posted there. So if you go to the UPMC CHC website, you will see it. But if folks want information before those meetings happen or after those meetings happen or have agenda items and they're not a member of the PAC, we're happy to entertain those and have conversations offline.
Hi, this is Maritza from Keystone First Community Health Choices. I'm going to mirror what our friends over at UPMC just said. I provided all of my contact information in my slides. So if you, if anyone is interested in participating, they can reach out to me directly, and I'd be happy to have a conversation with them.
Thanks. And this is just Malik from PHW. I'm actually standing in for my director, whose information is on the in the slides as well. So if you could reach out to us here directly at PHW, we'll be able to let you know when the next meeting is scheduled. I don't see that it's actually scheduled yet.
Hi, this is David from CARIE. I have a question for Keystone First CHC and PA Health and Wellness. UPMC CHC had mentioned that they also host participant forums in addition to their PAC meetings, and how participant forum feedback is relayed or communicated to these PACs. I'm wondering if PA Health and Wellness and Keystone First CHC could address whether they have similar types of community forums or participant events outside of PACs that could be, say, an additional opportunity for consumer feedback.
Okay, so this is Maritza again from Keystone for CHC. To answer your question, the answer is yes. We have been hosting CHC, Keystone for CHC education events throughout the Southeast region. I don't have any of those dates in front of me, but we have been hosting those events, like I said, throughout the Southeast region, and we've been inviting participants based on zip code. So there's always an opportunity to speak to one of our team members. It's just an added benefit.
Sorry, David, would you mind restating that question for me?
Sure thing. UPMC CHC had mentioned that they have participant forums in the community. These are open to consumers. They are outside of the PAC, but the feedback that is generated at these forums appears to be relayed or communicated to the UPMC CHC PACs. I was wondering if PA Health and Wellness had any similar type of events that is open to PHW beneficiaries and as an opportunity to get generate this feedback.
Actually, we do. So we actually have various committees that are actually similar to the PAC, and sometimes it's actually on the same day where there is an educational committee that we have where it's a separate discussion as it relates to what happens at the PAC committee. And again, those meetings have been in the past typically around the same day, but now that we've expanded into to the Southeast zone, we're working to split those up so that we have one for Southwest and Southeast. And we've definitely been having some challenges being able to identify community members who want to participate in the Southeast zone.
Thank you.
All right, and just a reminder, if folks have any last minute questions, we just still have a few minutes before we wrap up. So if anyone else has anything they'd like to ask, please make sure you're typing those in and sending them. Thanks.
Hi, this is David again. I appreciate that the minutes of these PAC meetings for each of the plans are available online on their website. I'm wondering if each of you could perhaps speak to trends or the most common types of feedback you receive at your plan and how the plan has responded to that feedback. I know it's a broad question, but if you feel like there's something that just kind of stands out, I think this would be helpful information to know. Thank you.
This is Willie from Pennsylvania Health and Wellness. I would say that the #1 trend or issue that is typically brought up during our committee meetings is related to transportation and some of the challenges that our participants have with the transportation. And so it's either that the incorrect vehicle came to pick them up, maybe the vehicle was not timely, and this is not just to the meetings, but just in general, using the service. And so what we've done during our last meeting is we actually had a representative from our transportation team there to hear the feedback and make sure that we can address it back with our vendor. And so the idea is that by hearing this information, and we were able to identify a potential root cause during the meeting that has been taken back to the transportation vendor with the hopes that by providing that information, we should see an improvement.
Thank you.
We could echo a bit of that at UPMC. Certainly specific things like transportation or how to file complaints and grievances, things of that nature. We heard that a lot more in 2018, especially here in the Southwest zone. We really spent most of 2018 spending time hearing a lot of just general questions about trying to understand community health choices and really understand how is this working with my Medicare or not, for folks who are not dual eligible and who are, CHC is their primary coverage. What does that mean for them? How is it different than what things were before? Obviously, early on, we fielded a lot of and not so much even questions, but just sort of held the anxiety that folks had around continuity of care coming to an end, and just tried to listen and be there and be present and provide information about that process. As we've moved into 2019, we've tried to have more nuanced conversations, more specific topics that we've tried to cover. Echoing what my colleague just said, in our last PAC meeting, we also had a representative from transportation come, and we had broken the group up into several topic areas, and I was actually in the transportation group. And it does make a difference having people from the managed care organization who are specializing in that be in the room with the participants and the caregivers, hearing their questions and concerns, explaining the process to them. And I think overall it's really helpful for everybody. We're hopeful that there were some good ideas about how to communicate the transportation benefit to folks that came out of that small group. And we're hoping that at some point we're going to be able to move those ideas forward. But it runs the gamut for us. We hear a little bit of everything.
Great, thank you.
I think, and I'd hate to do this, but honestly, we all know that transportation is a hot topic. So, and just to reiterate what has already been said, it's really. We hear different, we get different questions and different concerns at every meeting, depending on the topic at hand. And it's really about, the PAC meeting is so that our participants have direct access to the folks that can answer their questions and provide support. And so I think we as a team have done a really good job at having the right folks in the room to answer questions and address concerns right there and then, while they have our attention.
Great, thank you.
All right, and just a reminder, folks can please send in, keep sending in those questions. All right. Well, I think that about wraps things up then. Thank you again to all of our presenters from each of the organizations who took some time today to talk about their plans. And again, we will be sharing all the information from today's webinar with folks via an email. And definitely make sure that you are sharing each of the plan's participant contact information so that they're able to become more engaged. All right, thanks everyone.
Thank you.